guys are probably here because you're really told by the doctor, told them everything that you've been going through, the exhaustion, the weight gain, the hair falling out, the brain fog, and they ran your blood work and they probably just came back and said, hey, everything looks normal. There's nothing that we can really do here, right? So I was one of them, and that's why exactly we are all here, okay? So keep an open mind here. First off, your normal TSH means that you're normal in your thyroid levels too, and your thyroid is completely fine. That is totally wrong, and here's why. Thyroid stimulating hormone is only a signal from your brain telling your thyroid to work. That's it. That's all there is. But it's so much more complicated. It never tells us anything about whether your thyroid is actually converting hormones properly. It tells us nothing about whether your immune system is attacking your thyroid, just like in Hashimoto's. It tells us nothing about how well your body is actually using thyroid hormone at the cellular level. Now, second old belief here is that they probably are telling you, hey, it's just a stress, right? But that stress alone is not a diagnosis. Stress is not an explanation for 40 pounds of unexplained weight gain. Stress is not why your hair is falling out by handful. Number three, medication manages downstream. So the problem here is that the medication doesn't fix the problem. Now, here's what medication alone cannot do. It cannot calm the immune system that is actively attacking your thyroid. It cannot address the nutrient deficiencies like selenium, zinc, vitamin D, B12. Those are very essential in thyroid health. And the last one here, fatigue is normal. Weight gain is just aging. Right? Feeling exhausted every single day is not normal, and not being able to lose weight despite doing everything right is not normal, and it's not part of aging either. They have causes, and the causes have solutions. T4 to T3 conversion is where your body is actually stuck with, and that's the root cause of the issue here. Three shifts that's going to change everything today. This is the framework that we're going to do. And I promise you, once you see things this way, you cannot unsee them. And that's where the real healing actually begins. So shift number one, what you're really seeing is not a thyroid problem. Okay, there's always something that triggered it before your thyroid problem became a thyroid problem. A conversion from T4 to T3. Okay, gluten sensitivity. A lot of people do have food triggers that they are not aware of because we really, as a standard practice of medicine, we really don't get to do the labs that really do food sensitivity alone, right? Toxin burden, hormone imbalances, chronic stress, TPO antibodies. So you need more labs than just a part of the labs that are usually being done at the doctor's office. Even if you're there to really find out what's going on with your thyroid, that's usually the issue here, right? Most doctors just run TSH, T3, T4, and just tell you something that, your thyroid are normal. But sometimes it really isn't the issue alone here. We need to really know TPO, TGAB, which is your thyroglobin here, and the ferritin, vitamin D, B12, gut health, hormones, and cortisols. Those are so important. And a lot of times you'll be very surprised at how people talk about high cortisol all the time. On the social media, it's all about high cortisol, high cortisol. But in many cases in Hashimoto's and or hypothyroidism, it's the low cortisol level that's actually affecting your body in a way that it shouldn't be functioning at. Shift number three here, okay? Healing requires removing the cause and it's just not managing the effect. There was, good months of time when I had to take levothyroxine on a very small dose until I was fine to get rid of it. A lot of times neuropathy patients only take pain medication, and gabapentin is really just to reduce the pain for the moment. And that's the same thing. What levothyroxine would do is it'll just give you that T3 thyroid hormone and it'll just replace on everyday basis. That's why you have dose every day just to replace it. But does it really fix the problem? Not really. You want to be really careful on what you're eating too, especially food sensitivity, gluten, dairy is common trigger factors in many people with hypothyroidism and or Hashimoto's, okay, your body has decreasing its functionality when it comes to the gut dysbiome, and something triggered it in the past, or stress added on, or habit of eating things in a wrong timing because we're so busy. So, and start really trying to eat healthier that can possibly get you somewhere with that too. Gut permeability, chronic inflammation, nutrient deficiency, blood sugar swings, and chronic stress. All of these do matter when it comes to the root cause of the thyroid issue. I want you to take a moment and imagine this for a moment, okay? Imagine waking up tomorrow feeling rested, not dragging yourself out of bed, not counting down until you can go back to sleep. That was me. Imagine your clothes fitting better, the scale finally moving, you're feeling like yourself again in your own skin, and you're ready for the vacation, and you're not really worrying about, oh, how am I going to do that hike on the vacation? That's on my wish list. But, it's just like you're so tired that you can't even do things like that. And I was there before. I felt like I was failing like as a parent because I have two little ones and I couldn't really provide for them because I knew that I wasn't providing for myself first. You have to be there first before you actually can provide for your family. Some of you probably are on a very clean diet and you're really thinking, what the heck am I doing wrong here, right? Well, you're not told what you don't know about. You're just told the information that your doctor has told you, or your internet told you, or you Google something, but it really did not give you the full picture where the Hashimoto specialist like me, who has Hashimoto's herself, has gone through with years of experience in fixing it to getting them back to normal again. Again, thyroid is not a thyroid problem. Thyroid issues are not just thyroid itself. You've probably accepted that normal labs means that you're just fine. Also, the conventional system isn't built for the root cause for the same reason that we talked about. They only do the fraction of the list of the labs that they should be running to really find the root cause of the issue to fix your body so your body's getting better so that the side effect of it is fixing all of your symptoms and the conversion of T4 to T3. Number three, people have tried things and maybe you've tried diet, like I said, or supplement or functional medicine sometimes, but without proper comprehensive testing and an individualized protocol that's right for you and your body particularly. And they end up with the pieces of the puzzle without the full picture here. And that's what's missing here. So now you probably are asking, hey, like I've tried everything. Right? I've tried everything, but have you ever had all of those panels and even the advanced lab that we're talking about, the gut dysbiosis lab, Dutch lab, or the hormone lab, the cortisol lab? There are so many things that we can do depending on what you're coming on with. And then I pick and choose the right labs that'll be right for you, right? And I understand that it can be just, like exhausting. You're like, okay, I've tried everything. I don't know what's next. But I hear you because I've been there before. I was sitting in your seat right there about 5 years ago. Okay. And what people tried could be just incomplete. To tell the truth, it can be sometimes can be a little bit hard to fix the whole puzzle together as a full picture. And that's exactly why we're here for that. If you're on medication and you think that that's going to fix your problem, unfortunately, again, not to blame on the medication, sometimes you need it. However, it doesn't really fix the root cause of the issue. And that's why you're still feeling the symptoms of your body just not doing well. Okay. So we want to really fix the root cause, not the symptoms itself. Now, when you're told the labs are fine, it probably isn't the labs that you're really needing here. Okay. We need to, again, we have the most robust list of the labs that we need to pick and choose for you, listen to your history and symptoms and what you've tried so far. So that way we know we're going the right directions. I love doing functional medicine because I get to play like a detective. Okay. What's going on with this particular case? What have you been doing so far? And what are the history telling me here that I need to dig in deeper? And what lab do I have to order for you to get this further and really get to know to get down to the root cause of the issue. If you have spent so much, what's causing you is making you stuck. Okay. If you're not getting the results, then what is the money good for? If you keep spending on the diet, you try the supplement you probably found on Instagram, it's not getting anywhere because you feel like you spent all this money, but you really didn't spend it on the right protocol, right? And it's designed to help your particular case, knowing what's wrong with your particular body and getting all of these things in the right ways without giving you harmful drugs. I want to tell you the hard truth. Honestly, I've been there before. I got stuck around trying to do something, but I was too busy. I just thought it was something that is normal with like, Hashimoto's or pregnancy. But again, it just snowballs. It just doesn't stay the same. It progresses to a point where it's really, really hard on yourself and your life. It's a lot when you know that there's more things that you can do, but you don't really get to live the life fullest level just because you know that there's something wrong with your body. If it is not addressed well, then the thyroid tissue can get slowly destroyed, and autoimmune condition can actually develop the other ones forward as well. So it's important that you know that your symptoms and problem is either autoimmune like Hashimoto's or just hypothyroidism, but you do have all these other things that are happening that is causing your thyroid issue, and it is also called gut axis thyroid. In a lot of cases, it is the issue with the immune system because it's not just supported by the gut health. A lot of different factors play role in it. That's why we do advanced labs to find out what exactly is wrong with your gut system. No two people have the same issues with the gut alone either. Again, I want to tell you my story because it's just really something that I love doing what I do, right? Because I found my own problem and then I got to the root cause of the issue. Then I found myself again. And I am really living the life that I am supposed to, providing for my two little ones without really second thinking about it or thinking like, okay, what am I going to do on this weekend? Because I don't have energy and like feeling like I'm a failure. It just means a lot when you are trying to advance in your life or you know that there are next steps forward and you think your health is limiting factor. It's huge because when you don't have health, you really don't have the right life that you want to structure forward with you. If you don't take any action today, I just want to say this very softly, but I do want to tell you the reality here because this is what I went through.